Hi, I'm Dr. Jill Morris of World Class Dentistry. Today I'm going to talk about neuromuscular dentistry and how that opens up a world of treatment for my patients. I am an accredited cosmetic dentist, so create beautiful smiles, but patients will come in to see me because their teeth are worn down or their bite is off. They've had piecemeal dentistry over the years, so things aren't matching well. They also grind their teeth down over time, and so their teeth get worn and cracked and discolored. And so, with the way I correct their bite, I actually return their facial dimensions back to a less collapsed face. I open up a space so that there's room to do a beautiful bite correction with the porcelain and create the beautiful smile, but even more so is the function. And what I found with this dentistry, it's lasting many, many years. Like a lot of my patients have had it for 30 years now. This is a process that I taught at a dental school for 7 years. Dentists would fly in from all over the world with their patients, and I taught them how to do this type of neuromuscular dentistry. It's a very physiologic type of dentistry. It helps the neck and the airway, um, even a feeling of well-being because it is a more relaxed jaw position, and it really allows us to do less drilling on the teeth. A lot of times the teeth are short to begin with because of all the wear and damage, and so I don't want to drill deeper into the tooth structure if I don't have to. I try to look at this holistically for the well-being of the patient, the longevity. If you correct the bite when you do the smile and make the smile pretty, then the porcelain and the veneers or the onlays, whatever I'm using, they actually last longer because the bite is in a better position, more relaxed position. People that grind their teeth, they call it bruxism. They do it for a reason, and it's usually they're trying to find a comfortable position for the jaw. So that's what neuromuscular dentistry does, and the results are phenomenal. So I'm going to go into my PowerPoint to show this is, kind of how I walk a patient through what I do from start to finish, and you'll see what this looks like. I'm going to show you some of my patients and what happens when you wear your teeth down and grind your teeth. This is a picture of someone with worn down teeth, uneven bite. You can see all the recession at the gum line. That is from the teeth bending so that they actually bend and the tooth structure pops off. We call that abfractions. So that's what many people have after years of grinding and clenching their teeth. You'll see roller coaster bites as well. Let's see if I can find photos of this. So here's somebody, they've got old dentistry, and this happens. You'll have dentistry done throughout the year, some piecemeal dentistry, so that one side or a couple of teeth are drilled on, and so the bite changes, and then someplace else. So the dentistry is mismatched, the bite starts to collapse, and the teeth wear down. So we'll see that as well. And you can see the wear here on the edges of these teeth. There's no enamel, and when the enamel's gone, the teeth wear at 7 times the rate. So it'll actually speed up once you're through with the enamel. So we really want to put the patient back to a beautiful position where they were in their 20s. This is Carol. She had very crooked teeth, as you can see here, and she didn't want orthodontics. She was in, her 60s and said, I just want a beautiful smile for the first time ever. And so with my neuromuscular dentistry, it frees me up so I can make room to make the teeth look straight. So that's what you're seeing here on the right. is the teeth all lined up. There was no orthodontics. It's just an optical illusion. Everything under there is just as crooked as it is here on the left. And so it is very life-changing for the patient. And I'm going to show you now how I do that um, with my equipment, my neuromuscular equipment, and the facial changes. So this is Linda. Um, this is her biting together before I restored her. And then after I restored her, I had her bite together. And so what I did is I placed veneers and restorations. I improved the bite with the neuromuscular bite. And so what happens is as the teeth wear down, the chin and nose get shorter and shorter because what determines this dimension is the teeth and the bite. So as the teeth wear down, the face gets shorter, you get the jowls, you get the lips rolling under. So really this picture on the right, this was no changes, no filler, nothing like that, no facelift. It's just this dimension through here has been opened back up to the dimension where it was before she wore her teeth down. And so the tissues all drape better. The other thing is the profile view. Many times the chin is back and this is very short. And so we find a really relaxed, nice bite. And that's why my dentistry lasts so many years is we're actually finding the neuromuscular bite, which is where the body wants to be. And the dentistry is not under stress or pressure. And so I have many cases that are 25 and 30 years old that look amazing still. So this is what helps the dentistry last. So I'm going to show you how I do that. My equipment, these are the electromagnetic, not electromagnetic, the EMG pads that pick up the muscle activity. The patient is hooked into a computer that shows me the muscle activity because it is the muscles that create the clenching and the bruxing and the grinding. So we want to find the most peaceful, passive position for the muscle so that the patient is relaxed. This is a magnet and these are sensors and I will track the jaw. And so I find the bite by looking at how much the face is collapsed, how short the teeth are, and what my muscles are doing. And then I know how much space I need between the arches, the top and the bottom teeth, in order to restore those to the youthful dimension that they once were. So what you're seeing here, this space, this is where the jaws should be. So everywhere you see space, I add porcelain to the teeth, which could be veneer, it could be a crown, it could be an onlay, it could be a snow cap, whatever the tooth dictates, and the aesthetic considerations, what the patient wants. The jaw joint is in a nice position. So it allows me to do things like this, where this patient had radiation and chemotherapy, dry mouth. They wore down their teeth. And this can happen, you know, with different ages. I'm seeing this more and more in young people, um, just, you know, stress and anxiety and other things. So this is a young person who really wore down their teeth. And so I neuromuscularly restored him. You can see his eyes are much more happy and peaceful. His face looks slimmer in here. His smile looks better. I mean, he's got to feel so much better about his smile and his function and the way he can chew. Here's somebody else. This was a soldier who had PTSD and bulimia, and so his top teeth were just nubs, and so we restored his smile. And then I'll show you one other person here, kind of a bird's eye view of what how I restore the teeth. And so this was another patient. Let's see if I can find her. She's down here. She also had bulimia, and So her top teeth had no enamel, so they were very short. And so I found the correct bite. Like you can see, this is her bite here. If you try to veneer the tooth, let's say she just went to a dentist to veneer the teeth, you'd have to grind away even more tooth structure. So that's the other thing with the neuromuscular dentistry, because I'm opening up the space, I can save tooth structure without all the grinding. But I found the space and I opened up her bite from where it had collapsed. There was absolutely no enamel. These were the nerve endings of the teeth. I got out the old dentistry. These were the old mercury fillings. I removed those safely so the patient isn't exposed. I built up her back teeth. I covered all those soft areas of the front teeth, and this is the bottom teeth. I did overlays and I did veneers here. And what she has is a nice level bite now so that it will last many, many years. Like this was done in 2001. I saw her last year. Everything looks great. So it's already been almost 25 years now. And this is her new smile. So I did a little lasering here for the tissue. You can see how the lip now is supported and fuller, and it really just makes a wonderful difference for the patient. But it's lasting dentistry. It lasts a long, long time. It takes me from start to finish about 12 weeks to do this, so it doesn't take long. And usually the patients are asleep while I'm doing it. We have IV sedation and oral sedation, whatever they want. This is what temporaries look like. But you can just see how the face just looks brighter, the eyes, what the neuromuscular dentistry does as a whole for the patient. So that's what it is. And I thank you for listening to that. And we'll talk to you later. We'll do another video on another subject. Thank you.